Welcome to this edition of the LucidQuest Public Health Strategic Roundup, covering developments from 16 July through 20 August 2026. The defining story of this reporting period is that public health progress is increasingly being shaped not only by new treatments, but by better evidence, prevention, access, and the ability of health systems to deliver innovation effectively. In this period, 4 key themes stood out. The first was the growing importance of lower burden care. 10-year prostate cancer data strengthened the case for focal therapy in selected patients, while intravenous iron before cardiac surgery reduced transfusion requirements in patients with anemia. Strategically, both developments reflect increasing pressure to demonstrate not just clinical efficacy, but reductions in treatment burden, complications, and resource use. That could influence reimbursement, care pathways, and adoption. However, neither approach has fully established a new standard. Randomized evidence for focal therapy and broader recovery benefits from preoperative iron remain important uncertainties. A second major theme was more precise risk identification. Genomic findings in fibromyalgia, associations between occupational pesticide exposure and ALS, and observational data linking estrogen-only hormone therapy with lower Alzheimer's pathology all point toward more biologically and environmentally informed prevention strategies. For developers and health systems, better segmentation could improve trial design, target selection, biomarker development, and allocation of preventative resources. But these signals remain largely associative. Replication, prospective validation, and clearer evidence of causality will be essential before they can meaningfully change clinical practice. The third theme was the potential value of time-critical intervention in HIV. A combination of antiretroviral therapy, neutralizing antibodies, and leronlimab cleared HIV in a newborn non-human primate model when treatment began shortly after infection. If translated clinically, this approach could reduce lifetime treatment burden and increase the strategic importance of rapid diagnosis and combination-based remission strategies. For now, the evidence remains preclinical, with the treatment window, durability, safety, and transferability to humans still unresolved. The final theme involved health system capacity. WHO and UNICEF data showed major sanitation and environmental cleaning gaps in healthcare facilities, while Research for Life highlighted the role of scientific access in strengthening research participation and evidence-based care. The implication is that innovation alone cannot create population-level impact. Infrastructure, knowledge access, workforce capacity, and implementation increasingly determine whether new interventions can scale. Progress remains uneven, making funding and execution critical watchpoints. Looking ahead, we will be watching randomized focal therapy evidence, human development of the early HIV strategy, prospective validation of emerging risk signals, implementation of sanitation and hygiene recommendations, and whether expanded research access translates into stronger local trial participation and adoption of evidence-based care. The key takeaway is that future public health advantage will increasingly depend on connecting innovation with lower burden care, prevention, evidence generation, and delivery systems capable of reaching populations at scale. Thank you for joining this edition of the LucidQuest Strategic Roundup. For more healthcare market intelligence and strategic analysis,